Hello, welcome at Handelsblad's U.S. election camp here in Washington, D.C. My name is Gilbert Kreiger. I'm here with Jeffrey Anderson from the Hudson Institute, a think tank based here in Washington. He's a healthcare expert. Welcome, Mr. Anderson.
Thank you, Gilbert.
We're here to talk about Obamacare, the healthcare reform that President Obama introduced in 2010, fully in force since 2014. How would you describe Obamacare?
Well, it's the main legislation of President Obama's whole presidency. It puts much more control over the healthcare system in America in the hands of the federal government. It expands the federal program called Medicaid substantially. Most of the people who have been newly insured under Obamacare are on Medicaid. And it also tries to expand the number of people with private health insurance, has a lot of regulations, the most famous being the individual mandate, which says, for the first time in all of American history, that private American citizens have to buy a product of the federal government's choosing from a private company or else pay a penalty.
Donald Trump, he's not a fan of Obamacare. What would he do if he becomes president?
If Trump becomes president, then I think you'll see a push right away to repeal Obamacare and replace it with an alternative. And this has been a battle in the United States now since it began in the first year of President Obama's tenure in office in 2009, and the American people have never liked Obamacare. They didn't like it before it passed. They don't like it now. And so this election will go a long way toward seeing what direction the country takes on this.
If Mr. Trump were to be successful in repealing it, will there be a new system, or will we just go back to the old system of healthcare in the United States?
No, I don't think anyone wants to go back purely to the old system. Most of the proposals, and I've put one forward at the Hudson Institute, that would be alternatives to Obamacare, would aim to fix what the federal government had already broken even before Obamacare was passed. One of the main things is that there's a big tax break available for anyone who gets health care through their job, through their employer, but that tax break has, ever since World War II, really not been available to most people who buy insurance on their own.
How quickly could these changes come into effect if Mr. Trump becomes president and implements some or all of these changes?
Well, to actually pass legislation, it's going to take a while. It would take, I would think, a decent chunk of 2017. I don't know how long. I mean, the earliest anything could really go into effect presumably would be like New Year's Day 2018. Now, a President Trump could also do a few things, maybe more than a few things, just as through the executive branch, because Obamacare gives a tremendous amount of authority to the Secretary of Health and Human Services. I mean, throughout the legislation, it's the Secretary shall, and it's just things are left at his or her discretion. And so that means that a lot of the decisions that have been made could be unmade within the while being true to the law. This is not some sort of extra legal process I'm talking about. And so you could have certain things changed along those lines. But as far as the big tentpole parts of Obamacare, that really would require legislation.